I saw a real need to start women's health research at Yale in 1998 because women really generally were not studied in clinical research. And as a consequence of that, it left this enormous knowledge gap about women's health, and we needed to remediate that. What we have done over the last 20 years is provide competitive funds to Yale investigators on areas across the board. So we study everything from cancers to cardiovascular disease, autoimmune illness, psychiatric illnesses, addiction, very important conditions that are either suffered exclusively by women or where there are really prominent sex and gender differences. Science is not always as clear about its findings as we need it to be. And what we want to do is make it understandable. So we have a great respect for the way in which the community can inform us about how they want to learn and how we can translate the information that comes from our studies and give it to them in a way that's useful so that they can be more informed about their own clinical decision making. Our focus and the heart of what we do is really research, but we've also been very interested in education. We have mentored junior faculty and postdocs and graduate students, and we have undergraduates come from Yale College who are interested in learning about science and research. It's been an extraordinary experience for us. These young people are so smart, so informed, and they really have the reaction of, I want to change this. And so they have been involved, and we have placed them in laboratories, and several of them work directly with me, and we mentor them and teach them, and they teach us. And these are the people who are going to carry this message forward in a way that's particular to their generation, and they're going to know how to do it. And over the last 20 years, we've progressed tremendously. The whole idea from the beginning was really to ensure that women were no longer thought of as a subgroup, but that the population is women and men, and subgroups depend on other characteristics of the whole population. And as we move forward in precision medicine, we're learning more and more about how even our individual cells and the sex chromosomes make a difference in terms of how our genomes are read. So no matter what the discovery is, there's always going to be a need to study women and men and to expand our understanding of difference among women and men.